So in this video, I'll be discussing the internal thoracic artery, also known as the internal mammary artery. So we have something called the subclavian artery, which we are already familiar with. We have subclavian artery on the left, we have it on the right. On the left, the subclavian artery comes from the arc of the aorta. On the right, it comes from the brachiocephalic artery. So once I have the subclavian artery, I need to know that it's divided into three parts. The first part of the subclavian artery is what gives me my internal thoracic artery. The internal thoracic artery will pass through the first costal cartilage behind the clavicle, and it will keep moving downwards until where? Until the sixth intercostal space, meaning that the internal thoracic artery terminates under the sixth rib and above the seventh rib, so it's in this space. How does it terminate? By forming two branches, musculophrenic artery and superior epigastric artery. Let's look at the branches for a bit. The musculophrenic artery will supply the diaphragm, and the superior epigastric artery will be supplying the anterior abdominal wall. It will be supplying the anterior abdominal wall by also anastomosing with the inferior epigastric artery. So superior and inferior epigastrics will anastomose together to form the anterior abdominal blood supply. And we said superior epigastric is coming from internal thoracic. Where is the inferior epigastric artery coming from? It is coming from the external iliac artery and at the inguinal ligament. So this is the termination of the internal thoracic artery, and this is the course. Now, during its course, it's also giving out some other branches. So let's see what these things are. First of all, we have the long pericardiophrentic artery, and this supplies the pericardium, it supplies the diaphragm and the pleura. And we also have anterior intercostal arteries. We're also going to be looking at these arteries specifically later in this video. And we also have the perforating branches. Perforating branches, the main ones are the second, third, and fourth. And they supply the mammary gland, and they go along with the anterior cutaneous nerves. So they are their course, they are accompanying the anterior intercostal nerves to supply the mammary gland. Anterior intercostal, from their name, they are supplying the intercostal spaces. So let us look at the anterior intercostal space. First of all, the intercostal space has anterior and posterior blood supply. Our main blood supply is actually the posterior, not the anterior. Because anterior, if you can see here in this photo, this is the internal thoracic artery. It's giving me anterior intercostal artery, and they're very short. They are anastomosing with the posterior, which is very long. So the chief blood supply is the posterior. Let me deal with the anterior intercostal first, and then we'll go to the posterior. Anterior intercostal arteries, they supply the intercostal spaces. How many intercostal spaces do I have? I have 11. The first 6 are supplied in this way. Anterior intercostal artery coming from internal thoracic artery. But what about the remaining 5? 3 of them have a blood supply, and 2 of them actually do not have anterior intercostal arteries. So the 3 that do have anterior intercostal arteries, but they are not coming from internal thoracic, where are they coming from? They are coming from this branch, if you remember. This is the musculophrenic artery, which is the termination of the internal thoracic artery. So we said that the internal thoracic artery starts from the first costal cartilage until the sixth intercostal space. During this course, it's giving anterior intercostal arteries, but then when it's terminating, what will continue? The musculophrenic. Now, the last part of the video will be about the posterior intercostal arteries. So again, we have 11 intercostal spaces. For the posterior intercostal arteries, we have blood supply to all of the 11 intercostal spaces. Unlike when we were talking about anterior, we said that the last 2 do not have anterior intercostal arteries, but for the posterior, all of the 11, they do have intercostal arteries. In the 11 intercostal spaces, 9 of them will be supplied in a way, and the first 2, we're going to consider them a bit unique. So why am I considering the first 2 unique? Because these first 2, they have posterior intercostal arteries that are coming from something called superior intercostal artery. And it's easy to memorize because they are the first 2, so they are on top. So superior intercostal artery. All you need to know is where is the superior intercostal artery coming from? It's coming from the costocervical trunk, which is what? It is the second part of my subclavian artery. First part gave me internal thoracic. Second part will give me something called costocervical trunk. The costocervical trunk will give me superior intercostal artery, and this superior intercostal artery will give me the first two posterior intercostal artery for the first two intercostal spaces. The remaining 9, the lower 9, will just get their posterior intercostal arteries directly from the descending thoracic aorta. And you also need to know that the right side, the right posterior intercostal, they look longer than the left because what they are also being supplied by the descending thoracic aorta, but the descending thoracic aorta is a bit towards the left. So this is why the branch to the right is going to be a bit longer, because the ones on the left are closer to the main source, and that's it. I hope this was beneficial.